This is your Fugitive Facts podcast, Hospital Series. How you can take care of yourself when hospitalized.
Help! I need somebody.
Hey everybody, let's talk about some common complaints patients have about their activities of daily living during a hospital stay. These include inconsistent hygiene assistance, linens not being changed daily, lack of privacy and dignity, and lack of assistance with personal grooming. Let's start by talking about inconsistent hygiene assistance. Personal hygiene is fundamental to patient comfort and health, but many patients report receiving inconsistent help. Imagine being unable to bathe or brush your teeth regularly due to illness or surgery, and then not receiving the support you need. It can be both distressing and dehumanizing. I've had friends in the hospital, and some days they received help with washing up, while other days they didn't. It made them feel neglected and oh so uncomfortable. My tip to them was, don't hesitate to ask for a daily hygiene schedule and communicate your needs clearly to the nursing staff. If you feel your hygiene needs are not being met, speak up or ask a family member to advocate on your behalf. If your requests continue to be unmet, ask to speak to the charge nurse or patient care coordinator or advocate. Document your concerns and follow up regularly until the issue is resolved. Just think about it. The emotional impact of not receiving regular hygiene assistance. It can affect your self-esteem and overall mental health. For those who are immobile or in significant pain, it's even more critical to have reliable support. Have you ever had surgery and felt very vulnerable? Not being able to clean yourself could have made you feel worse about your condition. Consistent help would have made a huge difference. Let's address the issue of linens not being changed daily. Fresh linens are essential for a clean and comfortable environment. When bed sheets and pillowcases are not changed regularly, it can lead to discomfort and even health issues. Just think about it if you had surgery. If your bed linens weren't changed for several days, you'd probably feel uncomfortable and you might even be worried about cleanliness, especially if you have an incision. Here's a tip. If your linens haven't been changed, don't be afraid to request fresh ones. Politely remind the staff or ask a family member to bring it to their attention. Keeping a personal log can also help you track when your linens were last changed. Okay, say your linens are still not changed after multiple requests. Escalate the issue by contacting the hospital's patient advocate or filing a formal complaint with hospital administration. So clean linens are not just about comfort. They are crucial for infection control. Hospitals need to prioritize this to prevent any potential spread of infections. Patients should be aware they have the right to a clean and safe environment. I had a friend who developed a rash due to unchanged linens, which added to her discomfort. Regular linen changes should be a standard practice. Did you know that privacy and dignity are fundamental human rights that every patient deserves? Yet many feel these are compromised in the hospital setting. Whether it's through shared rooms, open doors during examinations, or inadequate curtains, lack of privacy can make patients feel exposed and vulnerable. During a hospital stay, have you ever felt like you had no privacy, where staff would enter without knocking and your roommate could hear everything? As a patient, feel free to express your need for privacy. Ask staff to knock before entering and ensure your curtains or screens are properly positioned. Don't hesitate to remind them if privacy is breached. So if privacy violations persist, request a meeting with the nurse manager or patient relations department. Additionally, documenting each incident can help in escalating the issue effectively. One more thing about privacy. Maintaining privacy in a hospital is not just about physical barriers. It's also about respecting the patient's dignity. Hospitals should foster a culture where staff members are trained to handle patient interactions with the utmost respect. One more thing. Let's discuss the lack of assistance with personal grooming. Personal grooming, such as hair care and nail trimming, is often overlooked, but it plays a significant role in how patients feel about themselves. If I couldn't wash my hair or trim my nails for days, it would make me feel a little stinky and very low. During your hospital stay, you can advocate for your grooming needs by requesting special services. If you feel dirty or unclean or unkempt, ask for assistance with washing your hair or nail care. It's okay to be persistent and remind the staff of your needs. If grooming needs are still unmet, ask for help from the patient care coordinator or even the social worker, and consider involving family members to ensure your needs are addressed. Personal grooming can significantly impact a patient's mental health and self-esteem. Even though they don't always, hospitals should integrate basic grooming services into their care routines to enhance patient well-being. Feeling clean and groomed can lift your spirits, even when you're sick. It's a small but meaningful aspect of care that shouldn't be overlooked. If you've tried everything and nothing else seems to work, and you feel you need to file a complaint about hospital conditions, things like room temperature, inadequate assistance, cold food, or inadequate housekeeping, contact your state's Department of Health Services. For issues concerning your doctor, such as unprofessional behavior, incompetence, or licensing concerns, reach out to your state medical board. So thank you again for joining us for this episode of Fugitive Facts Hospital Series Podcast. Addressing these issues requires awareness and a commitment to patient-centered care. As patients, advocating for your needs and communicating clearly with the staff can make a big difference. If your needs are not met, don't hesitate to escalate the issue to higher authorities within the hospital. Until next time, stay curious, stay informed, and keep seeking the truth. Your health may depend upon it.